So now come to the abdomen. একটু উপরের দিকে নেই, আচ্ছা একটু উপরের দিকে নেই। Now ideally if you want to examine the abdomen, that is the very basic. 80% you are to examine the abdomen when you are going to cross this MBBS degree. And in your life, abdomen is called the magic box. Do you know?
Yes, sir.
It is called magic box because many things you will not be able to identify by many ways. That's why you should know how to. Theoretically you know, but if you go for a practical, you will not be able to do that, because now simple, if you want to see, what you will see? Shape of the abdomen, umbilicus, any scar mark, any stria or male, anything, any movement with respiration, any engorgement, every you know. But if you want to divide this abdomen into compartments, how will you do that? Theoretically you know. Practically how will you do that? Anyone can take this opportunity. How you will divide the very basic. Many of our students failed in MBBS class. Very good student failed because they know theoretically, but they have not touched, they have not taken the measurement, they fail to divide the abdomen. I know you theoretically 110% you will get, but how you do it? How it is done? How it is done? Do you know it? How it is done?
Transpyloric plane, transtubercular plane, and from the mid clavicle.
So 2 lines from 2 sides from the mid clavicle.
Mid clavicle. How will I identify the mid clavicle point?
By the clavicle, we will see the clavicle.
Clavicle. Yes, I am observing the clavicle.
So firstly, we will see the sternal end.
Sternal end,
Then we will see the scapular.
scapular
In
end.
the middle of that.
Middle of that will give you a point. Then another here.
So then
Yes, I am going here. Then another.
So then same side from that.
Yeah,
Mid
same.
clavicular.
Then
So then transpyloric.
what is transpyloric?
So from the tip of the 9th coastal.
Now you just see, you just feel it. How will you find the tip of the 9th coastal
So we
cartilage?
will tell the patient to lift, means to lift his
Yeah,
head.
head. Then
So then we will feel the lateral.
yeah, then
Yes, sir. So that will be the tip.
Lateral border of the rectus.
Yes, sir. So to
now that is your theoretical knowledge. Now this tip of the 9th coastal cartilage is 1. What is other way of dividing this line, by getting this line? One is tip of the tip. Yes, it is not that difficult. You just see the floating part. This is the floating part of the tip. This is the examination. You just feel this is the tip of the 9th coastal cartilage. There is 9. So you just feel over there. No go here. Go there, and this is the free end. It is the free end. Here go, and this is the free end. Then make the line, right? Another way. Are there any other way to find this line? Any other way?
yes, sir. There is one.
What is that? Any midline, and divide this midline in between.
So then we will draw a midline. Then in between the xiphisternum and umbilicus.
Yes. There is another way.
Yes, sir.
So midline, you xiphisternum, umbilicus, you cross this line.
Yes, sir.
And here you will what you will do?
Anterior.
Now this is the problem. How will you find the anterior spine? That is the problem. You have never done it. You are going to face your examination even after 3 or 4 months. You don't know how to find the anterior spine. That is the tragedy. Yes or no?
Yes, sir.
Now, anybody will be able to find it out? Among you, anybody? No shy. Anybody able to find it out how it is done? Theoretically you tell, but practically how you do it? That you don't do. So, please, আপনি একটু বসেন. That is the highest point of the iliac. You feel the iliac crest. This is the iliac crest. Feel it. শুয়ে পড়েন. This is the anterior superior iliac spine, right? From there, loose করেন. This is the highest point of the iliac crest. Okay, you go follow this. Then you will get the prominent area. This is the anterior iliac spine. Same way you come over here and follow anterior suprapubic spine. Then connect these two anterior suprapubic spine.
And we will get the
And then
transtubercular.
another plane,
Transtubercular.
transtubercular plane.
Yes, sir.
So transtubercular plane, that way you should find it out, right?
Yes, sir.
Then you draw the line. Ultimately, you will get 9 compartment. Okay? This is simple, but you need practice. The way is that you go the highest point of the iliac crest, then follow it, and then you will get it the prominent part, anterior suprapubic spine. That's why it is called transtubercular
Transtubercular plane.
plane. That way. Now, division is there. Then you will go for proper examination. You are fortunate enough. If you get, in our time, we had the time to come in the ward in the evening. That was our learning. Clinical class was in the evening. So, as because you are in this campus, you make a group among yourselves. You become your teacher. You just come here and practice yourself. Then you will be able to learn, and you will be able to learn for your next life. Do it, you will be benefited. I have given you my number. I shall take your number also, and I shall communicate with you directly or indirectly how you are going and how you are. Even I shall take your group student number, how you are teaching them, what is your performance. Then you will be directly under my supervision. Then you will learn yourself, you will demonstrate your students. Now you are going to be the master of your group. 5 or 6 or 7 students will be with you. You will be distributed, and they will be with you. It is your responsibility to bring them into the world and teach them how it is done. Practice them in the, not what I am telling. Make one video, open it up, throw this video, practice it. Forget me. I am not in a position to demonstrate anything. There may be many wrong with me, as because I am not with this thing for a long time. But what is there authentic? Even in McLeod's there is some demonstration videos.
Yes.
Go through that. Even any of you teacher blocking you, humble request, sir, the thing I am telling from McLeod, as because this is the information I am having, you can demonstrate it to your teacher with humble honesty, sincerity, politely. That got your confidence. Do that. No need to follow me. I am just giving you the tips how to do it. I am not ready to go through the McLeod and demonstrate you the abdomen. What I am giving you the message, you just go through abdominal examination. Go through some videos from McLeod. Read among yourself, see yourself, practice yourself. Because in the evening you are free. Don't waste your time in the table. Forget your table. Table will not give you any benefit. Honestly, I am telling. From my 50 years experience, table will not give you anything. When you come to your patient, you will touch your patient, your hand will be expert, your face will be expert, your eyes will be expert, you will be expert, and you will not be afraid anybody in the world. You will be able to demonstrate. As because you have got confidence, you have got papers with you. When I was appearing in MS Urology final exam, one of my teacher was telling me, what you are telling is not correct. Because that beautiful morning I got through the information from my book, which is upstairs library. Then I because that was pass and fail, life and death question. In our time there was no mark, satisfactory, unsatisfactory. If I cannot satisfy my patient, I will be failed. There was no marking, only satisfactory and unsatisfactory. Then I request, sir, please give me 1 minute time. I can go up, I shall bring the book which is authentic, I shall show you. If I am wrong, I have got no objection to make me fail. With that request I go upstairs, that with that book I demonstrated and I passed. Because you have got some confidence. If any of your examiner telling you it is wrong, you just humble request, I am going with McLeod's, I am going with that, I am going with that, which is authentic all over the world. You may not accept it. You may be wrong. Even you may be wrong. You may be my teacher, no problem. But you may be wrong because I am right, because I have got the document. That's why you should that much confident. If you got that much confident, nobody in the world to block you anywhere, any part of the world. Because in medical science, nothing new. Everything what you are telling, Australia, England, America, they are also doing same thing. The way you are examining, they are doing the same thing. That's why there is no difference. You are not the property of India. You are not the property of Bangladesh. You are the property of the whole world. You are the property of whole humanity. That way you should think. Forget about language, forget about color, forget about dress, forget about property. You are the property of this mankind. If you think like that, you will be able to develop yourself. And I think this is possible. I am trying to talk to your teachers coming morning to group yourself, especially those are fifth year students. What I am telling you, this project I took 3 or 4 years back in my medical college. Like you, I myself took the class, 30 days program, and 10 students selected. Like they were allowed to carry the mobile, to take some pictures and video from the patient, talk with their group, and ultimately when they appear, 7 students got honors marks in different subjects. It is possible because you are learning and you are teaching your group, and combinedly you are developing. What you are learning, if you don't teach other, your learning will not be complete. The more you will teach, the more you will develop. Yes or no?
Yes, sir.
So try to learn yourself, try to demonstrate it to your group, and try to develop everybody together. And there are 3 students only failed among 75 students in that group. Because clinically if you are sound, nobody will be able to fail. Try to develop clinically sound to prepare yourself for MBBS, for FCPS, for MS, for FRCS, for FRCOG, whatever the degree. It will be easy. Same anemia, same abdomen, same jaundice, same clubbing, same colonica, same thyroid examination, same breast examination, same DRE examination, everything will be with you up to your last breath. What I am carrying now. That's why try to concentrate. So now if you want to examine the abdomen, suppose then you go for inspection done, division done, then you will go for superficial palpation. When you go for superficial palpation, you should be sit. You will sit. Okay, second. You will sit by the side of the patient, and by this time you should be so close to your patient. The patient will be so cooperative that he will able to help you to make you pass. Sometimes he was telling Melena, that is very important information to make you pass.
Yes.
Okay? Sometimes cooperation is important. And then you will go for most important thing is, now you should wash your hand with some sanitizer that is not here, number 1. Then you will, if you cold weather you can warm it, otherwise if you hot weather, this weather no need. But washing with antiseptics is important, right?
Yes.
Then you will start. If you should be in right side, definitely. Then you will go for superficial examination. Again, from superficial you start from region. From this region you should go that way, 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 then you cover the whole area. And when you are doing it, your look should be
Patient face.
if I am doing it and doing it, is it okay? No, so when you are doing it, your face should be here. And you will get 0 if you do that, what I was doing. Okay? So when you go there, you will talk, you will see, you will examine, and you will see the facial expression. This is the superficial palpation. Then you will go for deep palpation. Among the deep palpation, again you go for region to region, right? Region to region. Yes, you can do it. That's why I am telling you go through your own way with authenticity. You can go like that, you can go like that, no problem. You can go like that, you can go like that, you can go like that. And don't miss to see the facial expression. Facial expression is very important when you see like that, okay? See like that. So this is the deep palpation. You can go for both hand, you can go for one hand, and this palpation is the find out the tenderness, right? Superficial and deep. Superficial is to see whether any tenderness is there. History will give you the which one is most painful, and that area I was there with very cautious, because that area was his initial origin. So when I was superficial, even deep, I was respecting that area, because that area should touch most later, because because otherwise patient will cooperate. Otherwise abdomen muscle will go into contraction. There will be rigidity. You will not able to palpate. There are three reasons. Number one, patient will be hurt. Number two is abdomen muscle will go into contraction. You will not be able to get in and find the liver or find the spleen or find any mass. That's why that area should be touched latest. That's why then after superficial and deep palpation, then you will go for what I was telling. Still I am not in correct way. I am going wrong way. So after inspection, I should go for auscultation. That is the new concept I was telling. That this is lack of time. I have got no stato. That's why I am not going that way. So then after auscultation, have I got any stato with you? Can you give me how it is done? That is important. Among this stato, you have got some. This is called earpiece. What will be the direction? This way or is it correct? This way. Why?
Hurt. It may hurt.
Why?
So it may be hurting if you do it.
Hurting?
Yes, sir.
Is it hurting or any other else? Sound. Why that sound? Everything there is some reason.
Yes, sir.
Why not here? Why here this way? Because if you place it, direction of your air opening. Air has got some external air and internal air. So opening of the external air will fit over there. If you, then sound will be okay. If you do that, it will go back. It will be obstructed. Okay? That is not the comfort. Comfort because it is already in the original hole. It is not obstructed by the muscle. That's why that's why it is here. After bell, then it is the connecting tube. Then it is the this is bell, madam. This is bell. Bell has got two parts.
Diaphragm.
Chest piece.
Chest piece and
has two parts.
Chest piece, diaphragm and bell.
So that is called. This is another part. That is the auscultatory part. It has got two parts. One is bell and diaphragm, right? So this is one segment. This is one segment, and this is another segment. This is the connecting tube. This is the earpiece, and that is the chest piece, and having two parts, diaphragm and where it is used. Which part is which used?
For abnormal sounds, we use bell.
Now this is the position. Okay. Now if you want to see the auscultation of the abdomen, which area you should auscultate to see the auscultation of the burburing sound or sound of the peristalsis? Right? Right to the why? Huh? There is some point. Why? Which is that point? You are correct, but that should be the gross area in the right iliac fossa. Why? As because why? Everything has got some reason why it is the place, and that place you should wait for how many time? At least 2 minutes. Even for difficult case you can wait at least 5 minutes, no problem, but not less than 2 minutes. And why it is here? Why not here? Why not here? Why not here? It is here, right iliac fossa. Because if you don't know the cause, you will forget. If you write it down, no use. That khata you will never open. That will give you no benefit. It will remain under the table. The thing you will be in your brain, that will persist. That is the important thing. So why it is here? Because when peristalsis comes to the small gut, at the point where it enters into the cecum, there is ileocecal junction. There is the place this peristalsis is obstructed. It is going over there, one-way valve. So that is the place it is coming, and when you are going, when you are obstructed by someone, in that place there is turmoil, more turmoil over there. What I am telling, if you are going, if you are blocked, there will be some sorts of more movement. So the peristalsis is coming and trying to push everything through the ileocecal junction into the cecum, but there is some bulb. So the peristalsis is blocked. So there is some rebounding. So sound is not that much important here, but here it is something due to blockage and something peristalsis is blocked, so it is more audible in this place. Am I clear?
Yes, sir.
Agree with me?
Yes, sir.
So you should be here. Then you will go. That may be normal borborygmy, that may be hyperperistaltic sound, there may be silent abdomen, that will be like that. Then you will go for inspection, auscultation, palpation, they will go for percussion. In percussion, what you will see? What you will percuss?
Tympanic sound.
What you will see by percussion? Liver dullness, yes, fine. Then I want to know your theoretical knowledge. Percussion, one of the technique where it is used. One used, you have mentioned liver dullness identified. Okay. Shifting dullness, okay. Fluid thrill is not the percussion. Fluid thrill is not the shifting dullness, agree. Liver dullness, agree. Any other?
Sir, any other palpable mass?
To find any organomegaly.
Yes, that is another thing. To find an organomegaly, there is one. Another thing, most important thing is before going for abdominal examination, most important thing not mentioned. What is that?
Sir, we have to ask the patient if he has any pain.
No. Anybody? Huh?
Bladder evacuation.
What?
Evacuation or bladder evacuation.
Yes, madam. Thank you very much. Without evacuation, you should not go for abdominal examination. And after evacuation, by percussion, you will be able to find out the bladder dullness. Okay?
Yes.
So, liver dullness, shifting dullness, bladder. And in case of any fluid contained mass, find out the bladder. Any fluid contained, that is, if there is mesenteric cyst, or there is any, in case of female, in case of ovarian cyst, very big one, to find that margin, you can go for percussion, dullness and percussion, go for that. And for percussion, that needs you practice, this should be moved, and that should be practiced, and then you find the upper border, and from up you will get that there is something like that, and then for suprapubic, you go that way, feed a suprapubic, make the margin. For shifting dullness, you come over here. If there is dull, then shift the patient for 4 minutes or 5 minutes. Why? Or 10 seconds. 10 seconds. Why? 30 seconds, not 10 seconds. Not less than 30 seconds. Why? Shifted. And then fluid will shifted, and this area will be full by.
Normal sound.
I am agree, fluid will be shifted, but this area will be covered by. Fluid area will be replaced by common sense. Intestine is there, that's why it is not dull. When you are coming, fluid is there, it is dull. When patient will change position, this gut will come over here. As simple as that. Why it is resonant? Because gut is there. Gut is floating. Am I clear?
Yes, sir.
এটা কি জানা ছিল? তাহলে কি জানা ছিল? সুতরাং but and even, so if, these are the very lame excuse. So this is the explanation, and then you will go for, then you will find it and you will write it down. So your duty is, I am fixing it, what I have told. I think how many percentage is new to you? If you 100%, what percent is new to you? 1%, 2%, 10% or 0%? Which one? 30%, 40% new. Is it? Is it? 30, and what you have heard new, is it acceptable, not acceptable? Acceptable? If it is acceptable, then forget me, forget everything. Just concentrate on your book knowledge. You find out your Hamilton belly, you will find your macloids, you will find your internationally accepted clinical method, go through it. Only general examination and abdominal examination. That is your assignment. That is you 10 come together, you practice yourself. When you become confident enough, he will exam, you will observe. He will exam, you will observe. Do it. Everybody residing in hostel?
Yes, sir.
Don't follow me. Because I am not a reference. Reference will be with you. Reference will be this net, reference will be macloid. Forget me. I am giving you the clue, I am giving you the way of approach. Follow the basic thing written and it is available in your place. But in our time it was not. So, and with that thing you just go on. And you have got only 3 days. Tonight, coming night, next night. I will be there, I will go to Khulna, I will come back, again I will meet you. Maybe in the night even. I shall talk to you, what you have done. And when I shall see you, then I shall, no need to patient. Some of our khala will be patient. Some of your security guard will be patient. You will demonstrate me with evidence of your macloid, not me. And then if I am confident enough that you are sufficient to teach your group, then you will be allowed to teach your group. Okay? And it is your assignment. General examination and abdominal examination.